Welcome back, everybody, to Pure Oxygen. Whatever pain you are suffering from, you can be sure that there is a pill, probably more than one, for it. But with all the pain relievers out there, how do you know which one will work best for your ailment? Here to guide us through the choppy waters of pain medication is Dr. Sekar Upadhyayula. How'd I do?
That was perfect.
I worked on this. Yeah, good answer, right? We'll call him Dr. U. How about that? Pain management physician at the University Pain Center in New York City. Thanks for being with us.
My pleasure.
If you're in any kind of pain at all, like I've had this shoulder pain for about a month and a half, but if you're you've banged your finger in a door, first thing you should do, should you go to a pain reliever?
Well, in general, most pain medications are designed for these minor ailments. The problem is people have a tendency to take pain medications for conditions that may not be so minor. So if it is something like you say you banged your shoulder, it's appropriate for you to take a pain medication over the counter and your choice. There's so many. However, if this was not related to a banged shoulder, if this was related to something more, you had nausea, vomiting, then that's a little more cause for concern.
Okay, good. We're going to talk about those more serious ailments that should send you to a doctor in a little bit. We've got a few pain relievers here with my tea in the background. All right, let's go through these a little bit and tell me what each one of these is good for.
Well, you can kind of divide these. If you divide them out, you have two categories of pain medications here. You have the anti-inflammatory medications, which would be these three.
Okay.
And you have the Tylenol.
Okay.
The Aleve, which is also naproxen, is excellent for conditions of the shoulder, inflammations. Bufferin,
let's back up a second. So let's say I'm sore from running, something like that. Sore muscles, that kind of thing?
Yeah, this would be a good choice. Any of these three for your condition of sore muscles would be a good choice.
Okay.
Often people take these also for fevers.
Okay.
The Bufferin is excellent for headaches, and as is Motrin for headaches as well.
Okay. Now you separated the Tylenol out, excuse me, why?
We're still not sure exactly how Tylenol works, but it is pretty clear it's not working as an anti-inflammatory mechanism similar to the other three. Tylenol is excellent for headaches. It's not as good for menstrual cramps, which we believe is due to inflammation, which we covered by the other medications.
Okay, or any muscle aches or something like that. One of these three is a better choice.
That's correct.
Okay, we're going to get a question for you from someone from the street. It has to do with interactions with drugs.
Okay.
Should I worry about taking Tylenol and going out for a few cocktails afterwards?
Well, the question is essentially about drinking and having Tylenol.
Mm-hmm.
The earlier belief was that if you took Tylenol and alcohol, there would be a problem. But now the main problem is Tylenol is metabolized by your liver, and the alcohol is metabolized by your liver. So taking large doses of both certainly can cause a little bit of liver damage. In the long term is more important than probably the short term.
Okay. How about any of these other three in terms of interactions with other medications you might be taking? Let's say arthritis medicine, something like that.
Well, the anti-inflammatory category as a group should not be taken together. Like if you're taking Motrin, you don't want it to be taking the Aleve as well.
Okay.
Because they work in the same manner, and you'll just be ending up getting more of a dose than you'd like.
But either one of these, in terms of just other medications too that someone might be on, anything, one of these to be careful of?
These are actually pretty compatible with most medications. Certainly the Tylenol is compatible with this whole group.
Okay. Let's talk about when you really should see a doctor. You mentioned earlier that, you know, if you're in pain, one of these could be a very good first step. But when should you really know that, you know what, this is more than a pain reliever is going to help and I should really see a doctor?
Well, in general, I tell my patients that if something hasn't gone away in a few months, then to think about other causes. We always have to not just treat the pain, we have to understand what the cause of the pain is. I would say that if you had any associated symptoms such as nausea or vomiting, or if you've had any abdominal pain is a whole gray area where there's so many structures there that automatically popping a pill is probably not the answer. And certain forms of headache, like if the worst headache of your life, that's probably good to see a physician as well.
Something's up in your body.
That's correct.
Dr. Yu, thank you very much for being with us.
My pleasure, Kathleen.
And always, as we've said many times before, check with your doctor if you have any questions about any of these pain medications or interactions or whatever. So if you've got a question for our pain expert, Dr. Yu, he's going to stay around for an online chat here at 1:30 Eastern Standard Time. Just go to Oxygen Online, type Thrive On Air Chat in the shortcut box at the bottom of the page. You are watching Pure Oxygen.